The World Health Organization is declaring MPox a global health emergency after an outbreak in Africa quickly spread. So far in 2024, there are more than 17,000 reported cases in Africa, both confirmed and suspected. Health officials warn the potentially deadly virus could spread internationally, but right now the risk in the U.S. is very low.
We have yet to see any cases here, so I don't think you should get too alarmed if you see a child who looks like they have the chickenpox. It probably is the chickenpox.
The doctor says MPox is more severe than chickenpox. Symptoms can include fever, fatigue, and muscle aches, but there are other things to look out for. So let's bring in Matthew Sims, Director of Infectious Disease Research at Corewell Health. Thank you for being here with us.
Happy to be here.
So Dr. Sims, let's start with the basics. What is MPox?
MPox is a viral infection. You may remember back, I think it was in the 90s, there was an outbreak here in the U.S. that was associated with imported Gambian rats as a sort of an exotic pet. It affected some people in the Midwest, and then it sort of ended. It's always been around in Africa at relatively low rates. But more recently in 2022, there was a change in the virus, and it got into a different population. It started spreading through men who have sex with men, which it had never really done before, and it sort of went worldwide. It's been relatively controlled since then, but this new outbreak in Africa is yet another version of the virus, and it appears to be a bit deadlier.
Okay, very concerning there. We've mentioned some of the symptoms: fatigue, headache, fever. What are some of the other things that people can look out for?
Yeah, the rash is the big one. You saw the picture of it on the hands there. This particular one tends to be more on the genitals, but it's also a fainter rash. And it can spread sexually. It can spread through just contact with the rash. And so it's been spreading pretty aggressively in Africa right now, mostly in the Congo. I think 90-something% of the cases are there. But it's been found in, I think, 13 countries in Africa right now, including 4 where it had not been found before. And just maybe an hour ago or less, I just read that Sweden is reporting its first case.
Now, you mentioned it being deadly. Can you go over some of the differences with this virus and something like a chickenpox?
Yeah, chickenpox, it's uncomfortable, but it very rarely leads to death. The death rate right now is somewhere between 3 and 5% in Africa. There have been over 500 deaths, and that was with about 14,000 confirmed cases. It's hard to know just how deadly it would be if it, say, came to the United States. The healthcare systems are so different, and unfortunately, the sheer number is overwhelming the healthcare systems in Africa right now. That's part of why the WHO declared the emergency. They've freed up funds to help with it. But one of the big issues is trying to get the vaccine, which is available, to Africa, where they really just don't have it.
Okay, let's talk treatment. What are things that people can do to try to get over this if this is something?
Yeah, so there is a treatment, and it's an antiviral. It's called Tecoromat. I'm probably horribly mispronouncing that. And it is available here in the U.S. How easy it's going to be to get it to Africa and in the numbers they might need it's much harder to know. It's the big problem right now is getting the needed vaccines, getting the needed treatments, getting just the needed care to the population in an area where it's healthcare is difficult.
Okay, and lastly, just because a lot of people are concerned, is this something that people should be very worried about right now?
It has not yet been reported in the United States. As I mentioned, as far as I know, the only case outside of Africa right now that's been reported of this new version is in Sweden, but it is always a concern. The 2022 outbreak started small but progressed pretty aggressively. As I said back then, it was not like it was not the next COVID, right? It was significant. It was something we had to deal with, and it was something we had to both prevent and treat. But it wasn't something that spread as easily as a COVID and hit so many people like COVID did, where it ground the country to a halt. And I don't think this one will be either, but it is spreading fairly rapidly in the community that it's in right now. We just have to keep a very close eye on it. And the WHO declaring the emergency this quickly is very helpful, because the longer they wait, to do that, the longer it takes to free up resources for people to take it very seriously, that sort of thing.
Dr. Sims, thank you for joining us.
Happy to.